My name is Premila Thampi and I work at the BMI Saxon Clinic. I specialize in gynecology. My special interest is benign gynecology, where I deal with women with heavy periods, painful periods, women trying to conceive, women who have early pregnancy problems, women who have pelvic pain, ovarian cyst, problems with sexual intercourse, and with prolapse. Majority of women whom I see in the clinic are benign gynecological problems. I also offer a health check for women in the age group of 40 to 58. Hysterectomy is the surgical removal of the uterus or womb. It is one of the most common gynecological operations. For most women, having a hysterectomy comes as a relief, particularly for women who suffer from heavy menstrual periods. For others, being told that they need a major operation comes as a major shock. After the operation, you will no longer have a period or be able to get pregnant. Your doctor may advise you a hysterectomy because of heavy, irregular, painful periods, which is not treated by either medical or other conservative methods. You could have a fibroid uterus. Fibroids are non-cancerous growth in the womb. The doctor might recommend a hysterectomy due to endometriosis, a condition where you have tissue fragments of the womb which attach and grow in other parts of the body, causing pain. Adenomyosis, similar to endometriosis, but a condition which is limited to the muscle layer of the womb. You also might be recommended a hysterectomy for severe, untreatable or recurrent pelvic pain. You could have a hysterectomy for recurrent pelvic infection. You are recommended a hysterectomy for precancerous changes in the vagina, cervix, uterus, fallopian tubes, and ovaries. Very rarely, a hysterectomy is performed as an emergency procedure, particularly in life-saving conditions like uncontrollable bleeding during childbirth. There are different ways to perform a hysterectomy. Abdominal hysterectomy is a procedure where the womb is removed through a cut in the tummy. Laparoscopic hysterectomy, a procedure where you have small cuts in the tummy and the womb is removed through the vagina. Vaginal hysterectomy, a procedure where the womb is removed through the vagina and there are no external scars. Total abdominal hysterectomy involves removal of the womb or the uterus with the neck of the womb, what you call the cervix. Subtotal hysterectomy involves removal of the womb and leaving the cervix behind. You also have hysterectomy with salpingo-oophorectomy, where the womb is removed with either removal of one or both tubes and ovaries. Whichever type of hysterectomy you have, it is a major operation. Every patient recovers at a different rate. After a hysterectomy, you will have pain and discomfort for a few days after the operation and possibly longer. The rate of recovery depends on the mode of hysterectomy. A vaginal hysterectomy patient recovers slightly quicker than a patient who has had an abdominal hysterectomy. Usually after hysterectomy, it takes about 6 to 8 weeks before you resume normal activities like driving, doing household activities, or start doing exercises, unless there are complications or certain procedures which needed more to do at the time of hysterectomy. So after routine hysterectomy, If it is straightforward procedure, women can return to normal activities within 6 to 8 weeks. If you have a hysterectomy and your ovaries are removed, and if you have not gone through the natural phase of menopause, you are likely to experience menopausal symptoms. If you have your womb removed and the ovaries are left behind, you could still experience menopausal symptoms slightly earlier than expected. The menopausal symptoms are hot flushes, night sweats, inability to concentrate, dry skin, dryness of the vagina, feeling low and anxious, being less interested in sex. However, women who have menopausal symptoms can get better with hormone replacement therapy, and it is advised by the doctor the appropriate mode of hormone replacement therapy which will help alleviate your menopausal symptoms. The patients I see in my clinic are women between the age of 18 to 60 or 70. I also see adolescent girls between 16 and 18. The women I see in the clinic are mainly benign gynecological conditions, and they are referred via the GP, through their insurance company, or direct referral from patients through the information provided on the website. I do a clinic twice a week on a Monday and a Thursday morning between 9 to 12 a.m. I also see patients on Saturdays if I have the time to do a clinic. Referrals to my clinic are either through the website or referral from a GP or a direct referral from the patient. At times, I see patients without a referral letter from the GP.